Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning, good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And I am so excited today because we're going to be combining several of the things that I love. The first is entrepreneurship, but more importantly, we're going to be talking about pet care, businesses related to that, all sorts of good stuff. And so please join me in welcoming Dr. Tina Neel to our program. Dr. Tina Neel to our program today. Welcome, Dr. Neel. How are you?
I'm doing really well. Thank you. I'm happy to be here.
Great. We're having a bit of a Monday, but it's going to be
Yes.
just fine, right?
Yes.
It's been a Monday. So let me tell folks a little bit about you, and then we will jump into this. So Dr. Tina Neel is a nationally recognized veterinarian, entrepreneur, and mentor with over 4 decades of experience in clinical practice and veterinary business leadership. She has founded, owned, and sold 11 successful veterinary hospitals and currently coaches business owners on how to build profitable, sustainable companies without burning out. Dr. Neel is also the co-founder and CEO of Angimal.
Angimal.
Angimal, Inc., a biotech startup advancing new cancer therapeutics for animals, and she serves on the board of Angiex, Inc., a clinical stage company developing targeted therapies for human cancer. So again, Dr. Neel, welcome.
Oh, thank you. I appreciate the opportunity to speak with your listeners.
Great. Well, I always like to ask my guests, how the heck did you get to where you are today?
That is kind of a long, funny story. And people ask me, did you plan this, all your life? And I say, no. All my life, since I was 5, I knew I wanted to be a veterinarian, and I never wavered from that. But I was just like a pinball in a pinball machine, and wherever life hit me, that's where I went, and I just tried to make the best of everything, and it ultimately worked out really well. But it was a little traumatic sometimes, but
yet you have had such a successful career, and in a world that is often challenging, right?
yes.
You're bringing life into the world, and you're helping it exit the world. And that gets to be hard.
It is. That's, kind of the hardest. I love delivering our pigs, our calves, puppies.
That's right. You are in Oklahoma, so you are a large animal vet.
Well, I'm actually small animal now, but I grew up on a dairy and wheat farm in southwestern Oklahoma.
Okay.
And my intent was to be a large animal or mixed animal practice. And I was going to Texas, but I had a job and a license in Texas. And then my husband at the time didn't have a job in Texas. So we went to Oklahoma City, and I was there 46 years. And now I'm, along with one of my longtime veterinarians, have a practice in Prosper, Texas. So that's where I am right now. So I split my time between Oklahoma and Texas.
Right. But, and of course, they don't get much bigger than the animals in Texas.
No. And honestly, the people in Oklahoma are really nice, and the people in Texas are really nice. It's gratifying to see how much they care for their pets.
Oh, and especially ranchers, right?
Yes.
They know that those animals are their livelihood and their lifeblood, and they want to provide them with the absolute best care that they can.
That's exactly right. And when I was growing up, our dairy cows were kind of our friends too. And they all had names, and it was and if you got a cow named after you, that means we liked you.
That
We
was.
we would never name a cow after somebody that we disliked or was
What
mean.
about an honorary bull?
Oh, my dad would name them, and one of them he named Joab.
Dear.
And so it was a very large, about 2,500-pound dairy bull, but he when we were little, and our dad would tell us funny things to make us grow up to be functional people, and he'd tell us, now if that bull chases you, you just poke him in the eye. Like, we were going to. We knew he was joking.
Yeah, because you're like, okay, so then when it stomps on me, what do I do?
What I do. He actually told us to run to the fence post and go round and round it, get behind something. But so he's where I got a lot of my entrepreneurial spirit, because he always told me you'll never realize the value of your education if you don't own your own business.
Wow.
And I did not do that until I actually got laid off from my veterinary job during when the oil boom went bust in Oklahoma.
Mm-hmm.
And there just wasn't enough work for everybody. And so I said, as long as I live, I'm not working for anybody else. And I got a camper and put on the back of my truck. And then I started making house calls. And I gave out cards at church and school and things like that. And then I did that. I lined up enough relief work to pay our monthly bills. And at the time that happened, I was a single mom with 2 little kids. And after that, I remarried, and my husband and I have been married, be 40 years this summer.
Wow,
But,
congratulations.
yeah. So the first one went by really slow, but the second one's flown by, when you have a. And so we were able to take the kids with us and go make house calls, and then put in a little small building. And then from there, we were able to, we got an offer from PetSmart to open 3 clinics in 3 different PetSmarts. And at first I turned them down because veterinarians really hated PetSmart at that time. And and my husband says, you go back there and tell them yes, because those other veterinarians don't feed your kids,
Right.
And that was the springboard for us, because we owned them, made money from them, and then also had our main practice. And after 4 years, my mother-in-law died of cancer, and my dad died of cancer. My mother had breast cancer, all in about 4 months.
Oh, my.
And the kids' other grandfather died of cancer. So we decided we needed to take care of elderly parents and that sort of thing. So we've sold the PetSmarts. And then ultimately things, kept working out. Our main practice started growing, and then we started working and with other doctors to help them get into practice and own part of the practice and that sort of thing.
Right.
So,
And I love that you mentor other vets. It's funny. I was just in Ohio over the weekend, as we are recording this, at a big 3-day or 3 days, 3 agility trials. And which I thought, that's great fun watching agility.
yes.
But we were talking, standing there in the food line, right, about the fact that these gosh darn young vets don't have the foggiest idea about customer service.
Oh, that's
And yeah, and
issue.
And you've got a great program where you work with them to make them rock stars.
Yes.
But and it's funny because I see that in human doctors too.
Right.
They're treating the disease, but they're not treating the person or the animal or the
Yes.
animal's owner, all of those things. And of course, that's as important, if not more important sometimes, than the actual treatment. So talk to us a little bit more about that.
Well, that's a huge problem these days. And it's like being a pediatrician and hating the parents.
Right.
That's not going to work out
Mhm.
very well. And so, whether they're two-legged or four-legged babies,
Mhm.
the parents are making the decisions,
Right.
are the ones that can communicate with you
Mhm.
about what's going on because our patients can't.
Mhm.
And it's a hugely important thing. But a lot of people become veterinarians because they don't like people.
Right. And they don't want to have to talk to people.
No. And I'm lucky because I liked people and I loved animals. And my dad said I could talk to a fence post anyway.
That's why you and I get along.
Yeah, yeah, there's a lot of similarities between us. And just in the short time I've known you. And yes, that's something that it's really difficult to get across to people. And one thing, I've been thinking about writing a book called Bottle Fed Cats,
Ah. Mhm.
and about these recent generations where they don't really care about other people and they think the they're the center of the universe.
Right.
And it's because they're like a bottle fed
Right.
cat. That's
And a
the
singleton
angriest.
at that.
And a singleton, exactly.
Mhm.
It's foster mom thinks it's the world revolves around it,
Mhm.
and it doesn't have any siblings to be slapping them down when they get too big for their britches.
Mhm.
And so then they grow up, and then they're shocked to find out they aren't the center of the
Right.
universe,
I
you
know.
know?
I know.
And so we have less
Mhm.
children I come from a family of 5 kids, and,
Mm.
you know,
You
we
were a
said
working family from when you could walk.
we did everything together, and we learned our math
Mhm.
with the cows.
Mhm.
We counted the cows,
Mhm.
and eventually Daddy would tell us, "Oh, I'm gonna put in a new fence, and I'm gonna put a fence post every 8 feet. How
Ah.
many fence posts do I need?"
Mhm.
And then it got to be how many rolls of wire, and eventually, when I was in high school, and you had to do that in your head because there
Right.
weren't no
Right.
calculators.
Right. You might be able to scritch it out on the dirt, but
Yes, but not I and you'd have to calculate the, um, capital gains,
Mhm.
tax or the tax deduction you would get from doing this. And so, we were, all together, and that is something that's really, really helped,
right.
all of us.
Mhm.
So, having mom and daddy there.
Mhm. Right. And it's interesting. My veterinary hospital that we take all of our critters to, we went to it partially when we moved here because it was an older vet.
Uh-huh.
Good old country vet, right? In the middle
Yep.
of, in the suburb here in Atlanta. But he's a good old country vet. He went, "Oh, I've had beagles," because we have beagles, right? And they've all said that. But and then he brought some younger ones in because he was getting pretty close to retirement age. He mentored them. We loved working with them, and then gasp, he sold the practice. And he sold it to youngsters, and they are good vets.
Right.
They are very good vets. But yeah, just the customer support. And I want to talk about this because, so many people don't stop to think about the little things,
Right.
how you answer the phone, how you respond. Late last year, we had to put one of our dogs down. And it had actually been really sudden. She was fine and then she was not.
Right.
And so when I called to say it's time, I need to, we need to make the appointment. The receptionist, who I've known for over 10 years, I'm not sure we can fit you in.
Oh my gosh.
And I kind of paused. And I said, we'd like either the first or the last award, right? It's also for them. It's
Right.
and now, mind you, I have never been in there since this new folks took over, where there's been more than one person in the waiting room, so it's not like they're swamped.
Right.
But she and so I got a little hair up on the back of my neck, and I said, "Tell you what, I want you to pull up my records and see how many thousands of dollars I've spent there in 13 years." Well, darned if they didn't get us in. And I hate having to do that, right?
Right.
But, if somebody calls and I get that a lot of times people are, oh my God, the sky is falling. And no, it's really not. But we were having her euthanized. I mean, this was,
A traumatic experience.
yes. And, and then the vets could not have been better. In fact, they kind of took it to an extreme. We were in a darkened room and there was water, and I'm like, oh, no. But I truly appreciated it.
Yeah.
They were trying to make it as least traumatic as they possibly could. And I really liked that. I thought that was very special.
They could have started out a little better, though.
Mhm.
You know,
Yeah.
that's
And just little things. How long does it take you to be seen? All of those things. You and I share a cancer diagnosis, and one of my doctors that I fired because you don't get along with me, I fire you.
right.
And
That's so much like me.
he was my primary care doc. The only thing I saw this man for was my blood pressure medicine. I didn't have the parts for him to do anything else. Those were
Right.
gone. And I was in one time, and I sat in an exam room over an hour.
Yeah.
And I went out and I said, I'm leaving. And his nurse got a little flustered, and I said, I've been here over an hour for a 5-minute appointment. And then I look, and he's sitting playing solitaire, because I could see the monitor, playing solitaire on the computer. And I reported him. It was like, no, this is, and I don't know if his staff had not told him I was in there, had they forgotten me, all of those various things, but it was like, no. And in the people medical world, they call it patient-centered care.
Right.
And I tell them, but we're not central. Unfortunately, it's the insurance company. It's the everything else besides the patient. And, granted, in veterinary care, it's more personal pay, right?
Right.
There is insurance, but we don't always think, hey, we're the center. And more importantly, our fur baby is not the center.
Right. It's really important to remember that that is the center of what you do. And why did you become a veterinarian anyway? Because you loved animals, so you need to take care of them. And you need to help the people. For the last, well, forever, I've given out my business cards with my personal cell phone number on it. And, the younger, when I started, there weren't very many women in
No, you
medicine.
especially when you were studying large animals.
Yes, yes. It's just really unusual. So, and now it's, like 90% women. And, which has its pluses and minuses, but there's it's a situation where you have to realize that you became a veterinarian because you loved animals. So let's do everything we can to make that happen. And you can have a life and a family, and with more women veterinarians, there's more to pick up shifts. Maybe you don't work, um, you know, 80 hours a week, like I was prone to doing, and that you have time for a family too. But you've got to put those pets, that the reason that you became a veterinarian, first and foremost, and that means getting along with their parents and that sort of thing, and making them comfortable. But I give my phone number out so that they don't have to worry. They can text me or call me, and it's I've had to block 2 people in all these years, and one of them was just a friend that went crazy, and the other one was a person I'd never seen, and somebody just given her a number, and she was a breeder of, kind of a puppy mill breeder. And
Yeah, no,
so
you don't want anything
I
to
didn't
do with
want
that.
anything to do with her. And so now I tell the younger women, I said, now you might have a stalker. I'm not going to have a stalker, and everything. But now we have scribes on our phone,
Right.
and they allow you, I still just use my phone number, but
Mhm.
it allows you to make a call and it will record the call and put it in the record. Just simply from your phone, and it shows up as the hospital phone number.
I love that. I love that.
It's really nice.
And you've done a lot of kind of early adoption of the electronic type of medical records. So tell us a little bit more
Yes.
about some of those.
Well, I started in the 20th year I was a veterinarian, which would have been 99. I thought I could buy a new car or I could buy a laser. I'm going to buy a laser.
It's so fun.
It's not, and I used it. It would really irritate me when people say, well, you just got a bunch of toys. No, I use these for diagnostics or procedures and whatnot. And so I really like to stay up to date and on the cutting edge of things. But you don't throw the baby out with the bathwater. You still keep a lot of those good things, but you help modernize and anything that we have a CT in our hospital. I've been doing ultrasounds since 26 years ago this month.
Wow.
And that's how I was telling you earlier that we have 3 pets that have masses in their intestinal tract, and I found all them last night on using the ultrasound. And there's so many things you can see on it that you can't see on just an X-ray.
Yeah, because soft tissue does weird things.
It does. It does. And so, do you have friends that have doodles?
None so I am primarily a beagle person. And so, but yeah, it really is so much fun to see all the changes. Just is, I now had a cat growing up
Mhm.
and other things. My dad was a game warden, so I have pictures of us with a bear, a baby bear, before we turned it over to a rehab place.
Right.
All sorts of stuff like that. He had a badger one time. It was exactly what you think is mean.
It's mean, yes.
And
They really are.
but yeah, it had a little wound and it just needed to be cared for. But I never had dogs till I got married. And so, it was still, a little bit bizarre, but it's I think one of the things that so many people don't quite understand is how much money we will spend on our pets. Um,
Right.
and we want the best care. I mean, that's the thing is, now I do have to admit when our dog got so ill last year, they said, now our vet, he said, "Ooh, this is more than I can do." So he sent us to somebody else and they said,
Right.
"You really want to know what's going on? You need to have an MRI." And he said, "For that, you've got to go to the University of Georgia, to the veterinary school." And he said, "And that starts at $7,000. And we said, "No, thank you." And it certainly wasn't that we, she was 11 years old. We would
Yeah.
have not done anything even if we had known what it was.
Right.
And he said, "I just needed to give you the option," because somebody else might have said, "I'm going," but yeah, I mean those 4 or 5 days lumped together were about $5,000. And that is one of the responsibilities that you as a pet parent have to
Right.
think about. But yeah, it's but all of the I'm not going to call them a mixed breed. I'm not one of the AKC purists because
Yeah.
they all had to be mixed at some point to get to where we are
Right.
today.
Right.
um, but yes, at the agility trial, somebody had a baby doodle. Oh my God, that was the
They're
cutest thing in the
cute.
world. Hmm.
They are notorious for eating socks.
Socks.
Socks. And we have I don't know, probably a couple a week that come in to have surgery or make them throw up because they ate socks. And if they say it's a doodle and it's throwing up, you better check and see if there's a sock in there.
Yeah, and that's not going to show on an X-ray.
Right. It doesn't. There's little indications, but if it's a bone, yeah, it'll or a piece of wire, but yeah. And then with the ultrasound, you can see what the intestines look like, the layering, and all the
Did
other
it get entangled and all of those things.
Right.
Yep.
So
We had a cat one time that ate the long red Christmas ribbon, the type with the scissor, right? And it didn't quite take surgery, but it came pretty close. And because only part came out, and I kind of gently tugged, and he let out a yell. I thought, "Oop." And I waved you into the vet, and they were able to do fluids and kind of wash it on through. But yeah, I mean, and it's funny when you get, especially people who have had multiple pets, and even farm animals and ranch animals through the years, you got lots of funny stories that people are gonna, oh yeah, I remember the time.
that's exactly true. Years ago, when like the first year I was out, I went straight into emergency work. And so I was probably too dumb to know I probably shouldn't have been doing that, but there wasn't anybody else to do it. And so I was in the first emergency hospital in Oklahoma City. Me and another doctor were hired to open it. And I had some people bring a schnauzer in. And they said, well, we were getting ready to go to a movie, and we noticed there was a string hanging out the dog's behind. So they pulled on it. The dog started yelping, so and they went to the movie. When they came back, the dog was straining and pushing, and so they bring it up, and I get it up on the table and look at it, and it's a sewing thread. Two pieces of a sewing thread. And well, the only reason that would come out together like that, it had a needle on it.
Oh,
And so I took an X-ray, and that sewing thread passed the needle, but the eye of the needle was forward and the point of the needle was coming backwards. So when they pulled on that string, it pulled it sideways.
just pulled the thread out. Yep.
Yeah, well, they just pulled it a little bit, and it went sideways and stuck right there in the pelvis. I was able to sedate it and use some hemostats and get it out without surgery, but a lot of times. But that's the moral of this story. Don't pull on things coming out of your dog.
On Christmas ribbons, no. And just like kids, I mean, the trick is you don't know. They can't tell you this hurts right here. It hurts when I do X. That comes back to what I was saying at the start. That's that customer service, right? That's you saying, tell me more about what's been going on. And then it's like, well, 2 days ago they were fine, now they're not. And even if it's just your standard checkups, you still want to talk to the people and say what's been going on. They're aging. Are they slowing down? All of those various things. But yeah, it's you have to talk to the people or the parent. Let me put it that way.
The parent. Yeah. Years ago, before I was even a veterinarian, I heard a pediatrician talking, and he said, you always have to listen to the mama because they know. And almost always, they'll be able to give you the clues to find out what has been going on. And it's been amazing to me where we've had people. I had a man come in about a month ago with his dog, and he said if the dog was 10 years old, and it was sitting next to him in his home office, and all of a sudden his legs started quivering. And he said, I called my vet, they couldn't get him in. And he said, I almost didn't come, but I decided I better check it out. I almost feel silly. Well, turns out the dog had a major tumor in its abdomen.
Just
it
Change
ruptured.
positions.
Well, it had ruptured and was draining.
Mm.
And in all honesty, at noon, the dog was perfectly fine as far as he could tell from outwardly. He noticed a slight bit of difference, brought it in, and with ultrasound and imaging, it didn't have a great ending because it it involved an entire organ that couldn't be removed, and we see a lot of spleen tumors and are able to take those out, and
Right.
it either is curative or it buys them some really good time.
Right.
So,
Yeah, I mean, just like with people, there are a variety of things. And speaking of that, I mentioned in your bio, and you mentioned kind of all the cancer things that
yes,
that um, you and I believe we are of the trifecta club.
we are.
Because hello, we are overachievers.
Yes.
I told somebody the other day when I go in to my doctor, she's like, "Oh my God, you're back." Um, and
Something.
but yeah, I've known since, especially since I married into this, that cancer is very prevalent in dogs. I mean, I think
Right.
probably all living things get cancer. I mean, it's just a mutated cell.
Yes.
But they do, and I know people don't always like hearing this, but they do a lot of research
Yes.
on now they're researching to help the health of the animals.
Right.
I mentioned we have beagles.
Mhm.
It's a pretty
Very.
popular, yeah.
It's a very popular lab
Yeah,
animal.
yeah, and for a variety of reasons, they're little, they're cute, they're sweet, all of those
Mhm.
things. But yeah, one of the times when we had a dog that had a growth, our vets were like, we don't know what the heck this is, and we went up to Colorado State to the veterinary school, and that was a weird one. Now here's a weird one for you. He was a puppy, and,
Mhm.
young, and the growth was on the side of his neck. And it was big enough that his litter mate pulled him around by it. She was one of those. And what they finally determined happened was he had eaten grass seeds, and one had germinated and was working its way out, and that was what that growth was. Now that's a weird one. But the nice thing was that they opened it, they drained it. A lot of antibiotics later, he was a hunky dory little dog.
Mhm.
But yeah, talk to us a little bit more about why cancer, obviously has played a very important role in your business and your life.
Yeah, it has. My family doesn't die of heart attacks; they die of cancer. And losing my parents, my dad to cancer, and my mom had cancer, and she had breast cancer, and she was on an estrogen blocker, and same thing happened to me, except I had radiation and chemo that she didn't have. But now I'm having side effects from the estrogen blocker that I didn't really realize were. I finally figured out that you've got to just advocate for yourself. You're not going when you go, and that's part of my Surviving Cancer Substack, is to let people know the things that are out there that can happen that nobody tells you. And so you go along. My mom had Alzheimer's eventually, and her voice started fading, and we all assumed at the time it was from the Alzheimer's, but it actually probably was from an estrogen blocker because the same thing's happening to me. So till I realized that, I thought, well, I'm getting Alzheimer's too, because my voice doesn't carry like it did and everything. I thought my husband was getting deaf.
I
And so he had his ear checked, and it was my voice.
Oh no, oh
My
no.
grandkids said, "No, Grandma, you can't talk as loud as you used to." But so there's a lot of decisions that you have to make when you have cancer. And so I had a really poor experience with chemo. The first two cancers went well. They were surgical, and I barely missed any work. But I had not a good reaction to chemo, and not. I had a doctor with a terrible bedside manner because
Yeah,
I
you and I.
yeah, nobody in the world has ever called me a big baby because I've just never
Right.
whined. Or I just
You're
we
a
have to
tough.
do it.
You're a tough ranch kid.
Right. And so that isn't me. If I'm telling you there's something wrong, there's something wrong. And she goes, well, I'm not trying to kill you. Who says that to a cancer patient?
I know.
And so about the same time I got the second cancer, um, my husband and I were we were friends with a couple that had founded Angiex, and we were able to invest in it. And so we've been following it, for the last 6 years, and I'm on the board of directors of it. And so I get to kind of see behind the scenes and that sort of thing. And I really want people not to have to go through what I've had to go through, you probably had to go through, and that the side effects can be almost as bad or worse than the cancer. And so um I and then I was doing a lot of oncology work with pets. Not that I'm an oncologist, but there wasn't anybody in Oklahoma to do it. And so I worked with the telemedicine. So I had a remote doctor that went over the case and prescribed what needed to be done. And then I was the person that worked with the clients and the pet to administer it. And I thought, this is crazy. There's so much of this, and it's devastating to lose your pet or your best friend, whether it's four-legged or two-legged. And so my husband and I and the founders of the other company went together, and we founded Angimal. And this earlier this month, we started growing the antibodies that are necessary. It's the same type of, it's an antibody drug conjugate, which is what Angiex is, and it's nuclear delivered. And so it's an antibody that tracks to a tumor factor that's produced by solid tissue tumors and their blood supply. And so I can't take that drug, which is in clinical trials now, and give it to a dog or a cat, because I could once, but the next dose you gave, they would have a terrible reaction to it. So in our case with Angimal, we're growing the antibodies, and then that takes about 6 months, and then we have to use um, the labs to create them in a form that's acceptable to dogs or cats. And then once that's done, which takes about another 6 months, then you have a linker that puts the chemo onto the antibody, and the antibody works three ways. It hones to the cancer.
Very specific.
It goes right there. And so then it tries to kill it and tells the body to try to kill it. It goes to the blood supply and kills it, and it can carry a chemo to it. So when I had chemo, or you're given a like Keytruda checkpoint inhibitor, only about 12% of the drug that you need to kill the cancer gets to the cancer. The rest of it's going through the rest of your body. And it's just killing things indiscriminately. And so in this case, we're able to target the tumor and its metastatic lesions and the blood supplies to all them. And so instead of 12%, you can get 70, 80, 90% of it to it. And so you don't have the same side effects.
Right.
And now 90% of solid tissue tumors or 90% of human cancer are solid tissue tumors.
Right.
So just they won't work. This won't work on a blood cancer.
Because the blood, it's out your body.
Right. But the vast majority, it holds all kinds of possibilities for pancreatic cancer, breast cancer, just any solid tissue there. Now in dogs and cats, it's only about 50 or 60% of the tumors in them are solid tissue.
Okay.
But we're and they don't produce quite as much of the tumor factor that way as people do. But it should, we're hoping it will be effective against pets, so that I don't have to give people this diagnosis and say, well, we can't really cure it unless we can cut it out and it hasn't spread anyplace. We can give this and actually target therapeutically
Right.
the tumors wherever it is. So
Yeah. Yeah, chemo about did me in. My very first treatment about did me in. And, and so 10 years later, I'm still in treatment because then I couldn't do what they wanted. And so every 21 days, I go in and I get my blood drawn, and my doctor gets really annoyed when I say this. I say, "Yeah, you got to make sure we're healthy before you try to kill us." That's the truth, isn't it? Yeah, I mean, and it's, like you said, they're not trying to do that. There
no.
aren't alternatives. And even if you look at what, treatments 20 years ago, even just in 10 years, there have been major changes as to what has been going on. And so, yeah, I mean, it changes, and hopefully it'll be kind of Star Trekky and we can just wave a thing over it, go, yeah,
Right.
right, and it'll be gone. But,
Yes.
but yeah, I mean, we've made the decision several times with our animals to, if, like I said, beagles tend to get cancer a lot. And there have been times where they've been able to remove the tumor and they're perfectly fine.
Fine.
One of ours had thyroid cancer, which is, yeah, we've had three. Yeah, and it's,
Just more.
now they are in the same line, and we said, "Oop, that
Yes.
line stops here." But, and once we knew he had thyroid cancer, he lived for probably another year, and we did the make comfortable, all those things, but
Yeah.
when it was time.
Right.
And so, but yeah, but, has having cancer yourself and then, several others, has it changed how you do business or think about your businesses?
Well, especially the last time I had cancer and I was very sick. I was still going to work most of the time. I probably missed 2 weeks work total.
Mhm.
But the problem is that by that time I was in my late 60s and I had have a husband and 2 sons and 3 granddaughters. And so we had this very large hospital with 150 employees and 20 doctors
Mhm.
and I just realized if something happened to me, the exit strategy needed to happen before that happened to me.
Right.
And if I'd known I was going to live, I would have never sold my practice.
Mhm.
But I did.
Mhm.
Um because then they would have had to dealt with all of it
Right.
and that sort
Right.
of thing. And so then I found out I was going to live and then so I came and started another one. And so even though I turned 72 last month, but I love what I do and so it makes you think of your family, what's going to happen with them and when you have your own business it then that plays into a big factor for you. And I think also, um, I've always gotten along with people really well, but I have a kind of I'm I'm the doctor at work, and I expect my employees to treat the patients and um, their owners with respect and empathy and kindness. And if they don't not going to pay attention, then I'm not going to be your best friend. and so maybe I was a little bit harsh with some people. One of my best friends' daughter worked for me one summer,
Mhm.
and she was living with her aunt up here up in Oklahoma City, and she and a couple of the other receptionists were standing there just talking. And I went up there and I said, "What are you all doing?" And they said, "Well, we got done and blah, blah, blah." I said, "Well, I pay you to work. And so you either work or you clock out and go home." And I said,
One or the other.
one or the other.
Mhm.
And I said, I can go ahead and find you things to do, but you should be able to do that on your own. So you either clock out or you start working.
Yeah.
And she went home that evening to her aunt's house and she said, I found out there's two Tinas, the one I know and love and the one that works at Neel Vet. So,
Yep.
but it's kind of, I tell people, we're not in the business of making mistakes because it affects the pet's life and it affects the owner's life. And so it's not like you work at Home Depot and put the wrong bolt in the wrong deal. I mean, that is going to cause some aggravation, but it's not going to kill somebody or some pet. And so that's our obligation to make sure that we do the best we can. So we got to have our head in the game all the time, you know?
I know.
And so it's really,
And that's part of you being the mentor. You know, and I love that. Well, oh my gosh, Dr. Neel, we are almost out of time. We've had so much fun. I have to have you on again because there's like 5 questions at least that I didn't even get to ask.
okay.
Sure. And so, you know, one of the programs that you do offer is a 6-week Rockstar Vet program.
Right.
And you offer a newsletter for people like me who are just pet parents.
Yes.
We will link to your website. But yeah,
Okay.
what are other services that you provide aside from just being Dr. Neel?
One client the other day asked me, did I have more than 24 hours in my day that other people didn't have? Because I used to do it. Yes.
And you are not 72. Nope.
Well, some days I feel it, but I don't like to be bored. I like that. In fact, my youngest sister, I'll call her up and say, Eva, I've been thinking. And she goes, oh no, what's going to happen now? You know,
She knows. Yep.
she knows that if I've been thinking about something, something's going to happen. But yes, I work with Angiex and Angimal, and if they would like to check in to Angiex, we're in clinical trials. They can go to angiex.com.
Okay.
And it's angiex.com.
And we'll put that
And
link in the notes.
okay, that will be great because there's, people that don't have options, that this could be an option. It's not real expensive for them because we're providing the meds. And and then eventually we'll have Angimal results, I hope. And but also I have a Substack article, and it's called Surviving Cancer. And it's just my journey with cancer and things I think people should know that I did not know. And then our rockstar vets and our rockstar pet parents. And the easiest way for those is to go to LinkedIn.
Okay.
And under Dr. Tina Neel. And all those are free subscriptions. And I try to let everybody. I don't know if you've heard of kratom toxicity, and that's a relatively new thing. So I try to talk about helping your pet live a long and healthy life as pain-free and comfortably as possible. And I put in things that I see. I never have trouble writing because I just think about what happened this week.
What happened
today? What happened today? Okay, and write about that because that's something that unique. And so I try to. I really want people to be educated. So if you look on ChatGPT or you Google it, I'm fine with it. Just ask me. Whatever.
Yeah, make sure you say it a little clear.
Yes, it doesn't offend me at all. The better educated you are, the better your pet's going to get taken care of, and stuff and whatnot. So,
well, oh my gosh, this really has been so much fun. And I know you have fur babies that you need to go take care of.
Right.
So we will have you on again. But until then, do you have any final thoughts that you want to leave everyone with?
I think my final thought is to be kind. To be kind, whether it's to your animal or to other people, because you don't really know what those people are going through. And just saying a kind word. I've learned during COVID that people are lost their mind and we're treating people terrible, and they still haven't got their minds back completely. And that just the people in the drive-through, just tell them thank you for being there. And it can make a huge difference in people's lives. Sometimes you're the only person that said anything nice today.
I love it. And so true. I was flying over the weekend and I made sure to say thank you to every TSA agent that I saw.
Yes.
So
It's important because it can make a lot of difference in their lives, just the little things.
right.
Yeah.
Well, I have been having so much fun and I really can't wait to do this again. I'm Deb Creer. I've been having a good discussion, a great discussion, a fabulous discussion with Dr. Tina Neel. And until next time, everyone have a great day.
Thank you for having me on.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.